Continuing coverage tonight on a big mental health bill delayed to at least next January. I'm Frank Malloy.
And I'm Lori Johnson. Georgia legislative leaders hope to pass part 2 of a massive mental health overhaul this year. The main goal, get a better understanding of the state's mental health crisis through studies and to recruit mental health clinicians.
Well, with the bill stalling in the General Assembly, there is no plan to resolve the state's shortage of mental health clinicians.
We're going to struggle the most is first and foremost workforce.
Ashlyn Webb joins us in studio with more on the impact the shortage and this delay is having here in Central Georgia.
Good evening, Frank and Lori. This shortage we're seeing is a nationwide problem, but several state lawmakers on both sides of the aisle took it up as a top priority this year. It passed the House easily, 163-3, but it died in the Senate. That left dozens of behavioral health groups facing the problem, including the Community Service Board of Middle Georgia, based in Dublin. Lori Montfort is their Deputy Director of Behavioral Health. She says they're roughly 15 to 20 clinicians short.
Increases the wait time. It takes a little bit longer to get them in for their first therapy appointment than it did previously. It's also increased the caseloads of the therapists that we have,
meaning even more overtime for licensed clinicians on staff. Representative Todd Jones co-sponsored House Bill 520. He says that bill aimed to fix that shortage by forgiving student loans, easing training requirements, and making it easier to apply for and renew occupational licenses.
Basically, if you came from another state, you were in good standing with that licensing board, and you came across the border and wanted to work in Georgia, which of course we want you to come to Georgia and work here. Well, unfortunately, 520 not being in place will require significantly more hours to be able to get your Georgia license, as opposed to a presumption of license that 520 would have catered to, which would have allowed us to bring people onboarding them faster into the state of Georgia.
This was set to be part 2 of the historic mental health overhaul bill late Speaker David Ralston pioneered.
Georgia ranks consistently, sometimes 51st. I mean, there's only 50 states, and sometimes we're behind D.C. even in behavioral health. And Georgia, with House Bill 1013, made a historic stride to correct this deficit. And 520 is